I'd now like to call on Dr. Peter Smith, who is the president and senior scientist at the Institute for Work and Health in Toronto. He is also an associate professor in the epidemiology division at the Dalai Lama School of Public Health at the University of Toronto. Peter has extensive experience conducting research related to work injury and its consequences using large population-based surveys and administrative workers' compensation data. Welcome, Peter.
Thanks very much, Gail. And thank you everyone for keeping on at the end of your day. I'm going to share my screen, pull up my slides. So I'm going to briefly go through around return to work after long COVID. So what are some of the considerations that we should be thinking about from a health provider perspective, from a workplace perspective, and from a worker perspective? For those of you who don't know about the Institute for Work and Health, we're a non-profit research organisation based in Toronto. Our main objectives are to conduct research in two areas. One is how work impacts health, and the second is how health impacts work. When we think about COVID, it relates to both of these objectives. One of our key considerations in producing research is to make sure it's valuable, so it's useful in terms of the research that we produce either by policymakers, workers, workplaces, or other occupational health providers. So I must admit, I have joined the presentation relatively late today, so I don't know what's already been covered in terms of what I'll be speaking about. But in terms of long COVID and what we know about it at the moment, so we think it's about 1 in 10 people will develop long COVID in terms of people who have COVID, but it's really a moving target because at the moment, if you think about most of Canada, we actually don't know how many people are developing COVID. We have sort of reduced the PCR testing, we have some rapid testing, but a proportion of people will be asymptomatic, so they will never present for a PCR test. So trying to estimate the proportion of people who develop long COVID is quite challenging at the moment. But we do know it's a sizable amount of people. In terms of common symptoms include things like trouble breathing, chest pain, brain fog, fatigue, anxiety. We sort of saw some of those symptoms in the previous presentation from tweets that people may. However, symptoms might vary. One of the challenges, which I'll talk about, is that the presentation of long COVID can vary from individual to individual, which does provide challenges, both from a healthcare provider perspective and also from a workplace perspective. We don't know some of the factors or the factors that are associated with the development of long COVID. Certainly the information we've seen in a workers' compensation setting is that even things such as whether the person was hospitalised aren't great in terms of predicting who's going to develop long COVID. So if there are people who weren't hospitalised at all, who had fairly mild symptoms, which might develop long COVID, and other people. So it's a real mix of people in terms of the population who will develop long COVID. And this is challenging because if there were interventions to prevent it, it would be hard to determine who those groups might be. And also the common patterns of symptoms. So we're getting a better handle on some of the common patterns of symptoms, such as, say, fatigue and brain fog as in the last presentation. But people can present without those two symptoms, and that doesn't mean it's not long COVID. So what do we know about, as I said, the information is sort of still developing in terms of what's going to work with long COVID and return to work, but we can lean on what we already know works about returning to work when you have a health condition, in particular, a condition that's episodic and potentially invisible in terms of its nature. So we do know that the initial support from a supervisor or a co-worker in terms of an initial work absence is important. If people feel like you're faking to get away or not have to work, that usually is a good indication that return to work's not going to go that well because there's a lack of trust from the beginning of the relationship. We do know that designing modified duties or return to work plans that involve the worker, the workplace, and a healthcare provider are important. It's important to get each of those perspectives, in particular, the perspective of the worker in terms of returning to work, because they're actually the person who probably understands their symptoms and what they do best. We know that it's important to focus on the workplace and the worker. That's more effective than just focusing on the worker. In the presentation 2 ago, I was talking about how it is important to recognise that people can return to work when they're not 100% of their initial capacity. But that involves having the workplace reduce to a level where people can return to work. We've seen that with conditions such as mental health conditions, that often when workplaces don't know what to do, they want to wait for the worker to be at 100% to return to work, and that's often detrimental. Figuring out how to adjust both, focusing on the worker in terms of healthcare provision, but also focusing on the workplace in terms of accommodations is important to find the right balance. We know that contact between the worker and the workplace prior to returning to work is important, and also frequent check-ins and flexibility in terms of the task when someone has returned to work. With conditions that are episodic, some days a worker might be able to do a certain set of tasks and the next day they might not. So it's important to have these frequent check-ins to understand how things are going, whether things need to be reduced on a particular day or maybe can be increased on another day. And so these frequent check-ins and this flexibility, knowing that it may not be a linear process, that work can gradually increase over time, but that it might be that there might be 2 steps forward and then 5 steps backward, is important for both the workplace and the worker to recognise as they start the return to work journey. In terms of some particular challenges around working long COVID, which we would anticipate might present themselves, given what we currently know about the condition, given that there's a variety of symptoms, so 2 people with long COVID might present with completely different symptoms, and so there's not going to be a recipe for how you accommodate people with long COVID, but it's actually going to have to be a sense of trying to understand the symptoms, trying to understand the limitations across various domains in terms of what's going to work for return to work for each individual. The invisible nature of some symptoms creates challenges. As I said, if trust is lost at the start of the process, this can create barriers in terms of return to work, because when someone says, well, today I just having trouble concentrating, there's not a test you can give for someone to assess whether that's true or not. And so you do have to learn to, from a workplace perspective, take these conditions at face value and encourage people to report their symptoms as they change throughout the day. The episodic nature of conditions means that function can change on a day-to-day basis, and so job demands may also need to change on a day-to-day basis. And that's coming back to what I said before about you need to be prepared that the transition will not be a linear transition, but maybe a fluctuating transition over time. There's a lot of unpredictability in terms of how long symptoms might persist, and this creates challenges. We know that setting a date for when someone could return to work is important, but given that it's unpredictable how long that might be, that can create challenges both from a worker perspective and from a workplace perspective. And then for people who have got a work-related COVID infection, that can create particular challenges because they might be returning to the place where the infection occurred. And so we might need different approaches for work-related versus non-work-related COVID conditions. So in terms of focusing on the workplace and the worker, at the workplace, we do need to understand the demands of work. So and again, 2 presentations ago, there was a talk about the physical demands, assessing those, the mental demands, the social demands, so how people need to interact with co-workers and clients, and the environmental and organisational demands. We do have tools. So the ACE project, which is from the IWH, is developing tools. One of them is called the JADAPT, which is the Job Demands Accommodation and Planning tool. There's a link here on the website. Realise is one of our partners in terms of these endeavours. And this is a tool that can be given to the worker and to the workplace to have a complete coverage of what are the demands of work across each of these domains, and then what could be put in place in terms of accommodations. I think someone's got their, can you hear a bit of background noise? If you can make sure co-workers and supervisors are supportive in terms of taking symptoms at face value. From the worker, understanding what activities to avoid and also when to stop. So talking to the healthcare provider about when is a good time to stop. We do know that overexertion can exacerbate long COVID symptoms, and so we need to better understand when we should stop. Taking a very precautionary principle to that, knowing that, okay, that was good, and then next time we might push ourselves a bit further. Understanding the things you can and can't do, even if they're not part of your current job, can help in terms of understanding accommodations, because there might be other jobs available in the workplace, especially in larger organisations, which you could do, which will enable you to help that return to work journey start. So just to summarise the key points, long COVID does represent a potentially prevalent health condition, which will impact people's ability to work. So it's important that we're focusing on it. It's important to focus both on improving function, so focusing on the worker and healthcare provision, but also about improving accommodation and focusing on the workplace. Current approaches that we have to accommodating and communicating about episodic conditions likely will also be effective when it comes to long COVID. And so we don't need to reinvent the wheel, but we need to think about how to move what we already know about episodic and invisible conditions and how these might apply to a situation with long COVID. And then workplace healthcare provider activities to improve the employment for people with COVID. So if long COVID is an area where we start communicating better about accommodation, it'll actually also help a lot of other conditions as well. And so that's why I think it's important that we build on this momentum, because it will be of benefit to a variety of conditions, including long COVID. That is the end of my presentation. My contact details are there. If people want to write them down, I'll stop sharing because I know that we want to have a bit of time for discussion. Thank you.
Thank you so much, Peter. That was a whirlwind, and I think you managed to do it. So that's pretty incredible.